Let this be, we will see that later. We were continuing with the discussion on, we were halfway through the discussion on endocrine system, correct? I told you there are 4 aspects of the body's functioning that the endocrine system regulates. What are the 4 aspects that the endocrine system regulates? Growth, development, metabolism and reproduction. Growth, development, metabolism and reproduction. Simple. What will the hormones need for it to act on a particular target organ? What do the hormones need? Receptors. The hormones need receptors for it to act on a particular target organ. So based on where the hormone should act, the receptors will be present. Hormones with maximum receptors throughout the body would be the generic growth related hormones. Which are the hormones which will have maximum receptors for itself on the body? Growth hormone and TSH, and thyroid stimulating hormone. Not thyroxine or receptors. T3, thyroid hormone. Both of these hormones will have greater influence on the body. Growth hormone has receptors on muscles, bones, connective tissue. Thyroid hormone has receptors on cells also. So on the general tissues also. So thyroid hormone will bring about growth as well as differentiation of cells. So thyroid hormone will promote development of function. Function evolves because of the influence of thyroid hormone. Growth hormone stimulates division of cells. Growth hormone stimulates cell division and cell maturation as well. But predominant influence on the maturation is of thyroxine. Brain development is dependent on thyroxine levels in the blood. Metabolism, some major metabolic activities we need to know. Metabolism happens at a particular rate. The rate of metabolism is referred to as what? Metabolic rate, or the rate of metabolism at rest is referred to as basal metabolic rate, BMR, basal metabolic rate. What is the basal metabolic rate is determined by thyroid hormone, thyroxine. Alright, the significance of basal metabolism is important, you need to understand. See, when we look at, when we see the nutritional requirement for individuals, we estimate how much is the calorie requirement for any particular individual. Each food, what is calorie? What is calorie with respect to food? The amount of energy that is obtained by a particular food. There are different classes of food that we consume. What are the classes of food that we consume? Classes of nutrients in food that we consume: carbohydrates, proteins, lipids, vitamins, minerals. Of these 5, which are non-calorigenic in nature? Vitamins and minerals are non-calorigenic, that is, they don't generate any calories. Carbohydrate, lipids and proteins produce energy. When they are acted upon, when they are broken down, that releases energy, and what is the energy that is released is referred to as calorific value. Calorific value of a particular nutrient. Calorific value is mentioned as what? Kilocalories. Kilocalories or capital C. You write KCAL or capital CAL. Both are kilocalories only. So calorific value unit for estimating how much energy is produced by a particular nutrient is kilocalories. Which is the most which is the macronutrient that produces or gives you the maximum energy per unit? Carbohydrates. Okay, I'll ask you another way. Which of the 3 macronutrients have highest calorific value? Calorific value we can define as kilocalories produced per gram of that particular nutrient. Which has the highest calorific value? Protein, okay. There are only 2 more. So your chance of getting it right, if you are guessing, is 33%, which is a high probability in any guessing situation. Okay, we will get back to understanding energy a little bit more with respect to body and nutrients, and let's see if you arrive at answer to this question. Clearly you don't remember this answer, or you have not learned this answer. Thousands of years ago, when humans were still hunters-gatherers, when we did not have access to cultivated food, was there a possibility that we get food every day? There used to be times of fasting and times of feasting. So when you had a lot of food, you would eat a lot of food. When you did not have food, you have to survive by whatever you stored during your feasting days. So body had a need, whether it is human beings or any other organism. Let's consider it to be in general animals. I am just using it you and us because you can correlate it better. So your body had to identify ways or figure out ways to store energy which can be used when food is not available. Energy is in food. You break down food, metabolize it, energy is released. You fix that energy and store it. What is the form of energy that your body will utilize? What will your body utilize for its metabolic needs? Energy. It will utilize ATP. It wants ATP. But can you store ATP? You can't store ATP. So what do you have to store? If you want to store energy, you have to store it in the form of some chemical compounds. You have to store it chemically. Body has the task now, evolutionarily, to identify what should be the nature of storage. How should I store this energy? Energy is in chemicals. You are consuming chemicals. Chemicals are being broken down. Chemicals are being broken down in your body. When the chemicals that entered your body through food is being broken down, energy is released. That energy is utilized for the metabolic activities going on at that particular point of time. But if more energy is released because of the chemicals that entered your body, body can utilize only what is necessary at that point of time. Alright? If energy is available, if ATP is available, it will use only what is required. It will not use more. So what will happen to that energy or those chemicals which have entered the body, which is not required at this point of time? There are only two possibilities. Throw it or store it. It's like you are very hungry. You are very hungry and you want to eat food. In that excitement, you order more food. Let's say you order pizza. Generally, you order more than what is required. That is not the case with us because pizza is expensive. You don't order more. You will try to order two of different kind. Everybody gets one slice. So you get more variety at a bigger cost, but not so much to throw. Let's assume you order some food and there is excess food. You have ordered more. You have two options. You have to store it so that you can eat it later, or you have to throw it. Body cannot afford to throw it. Body cannot afford to discard it because body has got this food with great difficulty after a break of so many days where it did not get food. So body has to find ways of storing this energy, otherwise it will lose the opportunity of survival in the lean days when energy or food is not available. Right. So what are all the different chemicals that can be stored? You see, our body is made up of carbohydrates, lipids, proteins, and various combinations of these. Now the choice comes between these three. Which of this should I use as storage form? How should I store the excess energy? In what form should I store the excess energy? What will you think when you have to store? Let us say let's say I am a person who is polishing shoes on the street. I'm polishing shoes. I'm a cobbler who polishes shoes on the street. What will be the kind of denominations I will get as my earning? Will I get 500s, 1000s, 2000 rupee notes? I'll get 5 rupees, 10 rupees. I'll get my earning in the form of 5 rupee, 10 rupee coins, let us assume. On any given day, for 15 days of my earning is about 1000 10 rupee coins. I have 1000 10 rupee coins. I have to store it. What will I do? Will I put all these coins into a sack and keep it? What do you want to do? What do you suggest? You are my financial advisor. What do you suggest? Exchange into? Exchange the coins for notes. So if I have 10 rupee coins, what is the weight and the mass and the volume that it occupies compared to 100 rupee note? Storage is more sensible by storing more in a lesser space. More in lesser space is what is necessary. So body also, when it has to store the excess energy in the form which will give you more energy per gram of that particular nutrient when it is further broken down again. When you want to use it, you have to break it. When you break it, if I have A, B, C, A gives 1 unit of energy, all of them are stored in 1 gram quantities. I have stored all of them in 1 gram quantities. A gives 1 unit of energy when I break it, B gives 2 units of energy, C gives 3 units of energy per gram. So what should I choose to store? What should be the substance that I will store? I will store excess energy in the form of C, which gives me 3 units of energy. Because in that same space, I am able to store 3 units of energy. Now, ABC is carbohydrates, lipids, proteins. Not correlated to each other. I told ABC, there are 3 things that are the options for your body to store excess energy. Now you tell me, what is the body storing energy as? Or which of the 3 nutrients has the highest calorific value? Meaning, which of the 3 nutrients give you most energy or the maximum energy when broken down? When the same quantity of each of these is broken down, which one gives you maximum energy? Fats. Why do you say so? Earlier you told protein, now you are telling fats. Why do you say it is fats? I gave you a story, 2-3 minutes I spent on giving you a story of evolution and all that. He is telling fat is the nutrient which has the highest calorific value. That means by that logic, fat should be the choice for storage. Is fat the choice for storage in your body? No? Okay, what do you mean by excess available energy? Eating more. If we eat more than what our body needs, what will happen to the body? What will happen to the body? Body will start becoming big. Because of what? Because of fat accumulation. Why is fat getting accumulated and not proteins? Madam, why is fat getting accumulated? Sit, drink water. Why is fat getting accumulated and not proteins? She was sleeping. Okay. Now, why is fat getting accumulated and not proteins?
Sir, if we fast, carbohydrates will get adjusted first in fats and then proteins.
That is because of a different reason. But why is fat getting accumulated? Carbohydrate is like a 10 rupee note. Protein is also a 10 rupee note. Fat is a 22 rupees note. 22, okay, let us say 20 rupees note. Why is fat getting accumulated? Fat can store more energy per unit weight. Alright, fat can store more energy per unit weight. What has the highest calorific value among all the macronutrients? Fats. Calorific value of carbohydrates is 4 kilocalories per gram. Calorific value of protein is also 4 kilocalories per gram. Calorific value of fats is 9 kilocalories per gram. So, why do we accumulate fat in our body? Because millions of years have taught us that best way to store is fat. Why? It can store more energy in less space. That is why throughout our body we have adipose cells. Throughout our body there are adipocytes, adipose tissue cells. The cells which are capable of storing excess energy in the form of fat. Adipose tissue cells have the capacity to convert excess glucose into fat. Adipose tissue cells have the capacity to convert excess glucose into fat. Why glucose into fat? Why has the body been given the ability to convert glucose to fat? What is the predominant form of food that we get? Carbohydrate. The predominant form of food that we get is carbohydrate. Go into the forest, you go to a restaurant, you see your plate, what you eat, everything is carbohydrate. Predominantly it is carbohydrate. So what you are putting in is carbohydrates which will be broken down into monosaccharides. Glucose is the most common monosaccharide that is available on this planet as food. Glucose is available as in the form of food. The body is having excess of glucose at all the times or most of the times. Most of the cells being given the ability to convert glucose into fat gives the body the power to compact energy and store. Alright. Glucose can also be converted into, see again, breaking down fat for utilization. See how intelligent nature is, how intelligent evolution is. Breaking down fats to convert that into energy is more complex than breaking down a complex carbohydrate. So for immediate use, suppose we need energy, we are fasting, pushing energy into fat, taking out energy from fat, both of that is laborious. So you want to just keep it as money that is stored in the bank. Let us say adipose tissue is like the wealth that is there in the bank. You have deposited in the bank. Today you are short of 100 rupees. Today you are short of 100 rupees to take care of your expenses. Do you want to go to the bank and get 100 rupees? So to manage the day-to-day shortages and balance, day-to-day deficit of money for your activities, what will you do? You will keep some money at home, which can be easily accessed. Correct? If energy is like money, you are earning every day, you are spending every day, you are storing every day, you are withdrawing every day. There is a bank. This is an energy bank. This is an energy bank. Food that we eat is income. The metabolic requirement, whatever is used up as metabolism is expenditure. Then you have the balance sheet. Based on income and expenditure, you have the balance sheet of energy. If the balance sheet shows more energy, more money, it goes to the bank. First it goes to your wallet at home. You have some wallet at home. Can wallet accommodate unlimited currency? If the wallet is empty, you will just top up the wallet. And whatever is in excess will go to the bank. When you are in deficit, if your balance sheet on a particular day is showing negative balance, deficit, where will the money for covering the deficit come from first? It will come from your wallet. If the wallet becomes empty, then the money will come from bank. Understand? Storage. If you understand this economics of energy in the body, you can manage your body. Alright. So, excess energy is available in the form of, generally excess energy is available in the form of glucose, because of our eating. Now this glucose will be converted into dash for immediate usage, storage form, for immediate usage whenever there is a shortage. What is that dash? Which is like the wallet of your body? Glycogen. Glycogen is the wallet of your body. Glycogen is what is glucose converted to and stored in muscles and the liver. Why muscles? Those are the fellows who will need immediate energy if there is a deficit. I have not eaten, I am walking on the street, a dog starts chasing me. I need energy, no? My muscles need energy to run. So muscles are having a storage of glycogen. Glycogen is a complex carbohydrate, easy to break down. So for that immediate usage, there is energy available at the level of muscles. Then glycogen is stored in liver also. Why liver? Liver is the metabolic factory of the body. Well, whatever is available in the liver is easy to be acted upon. Liver provides that storage. Now, after all this is full, when the glycogen store in the body is full, still if there is still energy available in the form of glucose in blood, glucose will go to liver to be stored as fat. Glucose will go to adipose cells to be stored as fat. So liver can store fat. Liver also can store fat. Alright. So liver is storing two things. Liver is storing glycogen. Liver is storing fat. So liver is like the immediate backup. It's like the money lender on the corner of the street. Alright. Money lender in the corner at the corner of the street. Then you have the bank. How mechanisms are designed to ensure you survive. Okay. Now who decides? Who will tell? Who will tell that this glucose has to go and get into the adipose tissue as fat, get converted into fat, get stored in glycogen, get stored in the liver? Who will tell the cells to utilize glucose? Simple. No, we eat food. It gets digested. Food itself is the stimulation for the digestive enzymes to be produced. Digestion happens. Carbohydrates are all broken down. Glucose is entering the bloodstream. Glucose has entered the bloodstream. Now, glucose is there in the blood. Ideally, all the glucose should be utilized by our cells for their metabolism, because energy production requires this glucose metabolism within the cell. For all the thousands of chemical reactions happening in every cell, the cell requires ATP. ATP comes from the breakdown of glucose. So cells have to take up glucose. There has to be uptake of glucose by all the cells. An adult human being has about 100 trillion cells. So every cell has access to glucose in the bloodstream, in the tissue space. But why will glucose enter the blood, enter the cell? Glucose has to get into the cell, no? Just because something is available outside, is it available for you? Right? You are walking on the street, there is a bakery and there is a pastry on the shelf. You are hungry. There is a bakery, there is a pastry. But does that mean it will be available for you to eat? What is necessary for you to get the pastry to eat? Money. You have money in your pocket. Will you get pastry in your hand? Huh? No. What should you do? You should go and give that money to the shopkeeper, and the shopkeeper will give you the pastry. Activation of the receptor to give you entry of pastry onto your hand. So cells also have something to be activated for glucose to enter the cell. Cell has to be told. Cell is having requirement of glucose. Cell has a requirement of glucose. Just because it has a requirement of glucose, glucose will not enter the cell. Glucose can come into the cell through proper doors, channels. There are glucose transporters on the cell. Now this glucose transporter will allow glucose to pass into the cell only when it is told to take up glucose. Who is the one who will tell this receptors on the cell to allow glucose to enter the cell? Who will do this? Somebody should tell. Nothing happens just like that in the body. Everything is signal dependent. You get the signal, then you act accordingly. You don't have the signal, need doesn't matter. There should be signal. Where is the signal? It's just like, let's say, you have traveled in a flight. You have got out of the flight. You have just come out of the aircraft and you are walking in the corridor. You have crossed the gate. But you remember you have forgotten your phone. Can you go back and get it? Sir, I just came out. Sir, please leave, sir. I just go and get my phone. Will they allow you to go back? At the most, they might go and check and bring it back. They'll tell you to stay and they might go and get it for you. But you are not allowed to go back. Signal, why? You have to enter through proper channel. Perfect. So who is the one who triggers this? This is metabolism. This is basic metabolism, no? Survival is dependent on available of energy. Available of energy is dependent on the availability of glucose. Managing glucose metabolism is important for survival. Who manages glucose metabolism? Insulin. So, what is insulin's job? Insulin's job is to do three things. Number one, insulin will tell the cells in the body to pick up glucose. Insulin's level is dependent on the level of glucose in blood. So as the level of glucose in blood keeps increasing, insulin level will increase. Insulin will go and bind to all the cells in the body. Insulin is the one which will trigger the cells to uptake glucose, take up glucose. So insulin receptors are present on every cell. Without insulin, the cell will be starving. Cell will not have energy. Cell is demanding for glucose. Cell is sending signal to the brain. I'm hungry, I'm hungry, I'm hungry. It is all around. No, I'm hungry. There is one movie in Kannada. Alright, my mother tongue is Kannada. So hundreds of Kannada movies I have watched. There is one movie where comedians, both comedians are the actors here. The son comes back from jail. The father would have told, the father is staying in his sister's house, who is very rich. So this fellow would have told his son is in Singapore studying. But in reality he would be in jail. He comes back from jail and they are somehow managing that he has come back from Singapore. All that drama is going on. During post lunch time, the son is crying and he is crying and he is telling that he is hungry. The father says, why have you not eaten food? There is a lot of food available, go and eat. No, I can't eat food like that. Why? I can eat food only if there is a bell. He can eat food only if there is a bell. Then the father gets the bell and rings the bell and then he will go and eat food. So, cells are like that. Even if there is glucose available all around, they cannot take glucose. There has to be a bell. What is the bell? Insulin. Alright? Insulin. It extends beyond that. In the night he will not be sleeping. He will be crying that I want to sleep but I am not able to sleep. The father asks why. There are no mosquitoes. I can sleep only to the tune of mosquito. So it goes on like that. There are so many lame jokes. I enjoy it. Okay. So, insulin you understood? Insulin does three things. One, push glucose into cells. Two, tell liver to take up glucose and convert it into glycogen. Second process is that. So first, cells have to take up glucose. Cells say, okay boss, I'm done. Cells will not accumulate glucose. They will use whatever is required. Because it's a continuous process. Cells don't have a mechanism of keeping glucose as storage inside them. They will use it continuously. So insulin levels are maintained continuously. Blood glucose level is maintained continuously. There are receptors which will allow the movement of this. So cells have taken up glucose, there is still more glucose available. Insulin will tell liver to pick up glucose and convert it into glycogen. Liver says my glycogen stores are full, I cannot take anymore. No vacancy. Then the insulin says, insulin tells all the addicts of eating all that you possibly can, because along with the invitation they have given you the menu also as an enticement for people to come to the wedding to witness the grandeur of their wealth. Alright. So you go there, you eat nicely and by the end of that you feel that probably I will not need to eat for another week. Have you experienced this anytime in life? Where you have just gone, eaten up a lot of things and you feel like you don't have to eat anything for a long period of time. Has it happened? But have you realized the next day morning you will wake up hungry? Correct? You will have early breakfast. You will have more food in the breakfast than what you would normally have. What happened? Just the previous night after eating your dinner, you thought I will not eat for the next 1 week. But next day morning you are eating again. Staying true to the reputation of being food guzzlers. Okay? It's like this. Insulin's job is to do what? Push glucose out of blood. Insulin will push glucose out of blood. Two more concepts I want you to understand here. You can make note. One is called glycemic index. Glycemic index. Okay, we'll talk about glycemic index only now. Glycemic index. Okay, glycemic index is how fast or how slow or how fast a particular food gets into the bloodstream post after digestion. Okay. It is not the definition that you will find in a biology dictionary, but it is something that will help you understand. If you eat something, how fast it gets digested and enters the bloodstream. That is glycemic index. Now tell me, I'll give you two, you have uncooked rice, cooked rice and glucose powder. Which of the three will have the highest glycemic index? Uncooked rice, cooked rice and glucose powder. Glucose powder, because glucose powder will be quickly entering the bloodstream. It is already processed. It is already simple. Next would be cooked rice. That will also be digested better, faster. Next will be uncooked rice, because it will have to be softened, it will have to be broken down, digestion will take a bit longer. So glycemic index will decide how fast glucose will enter the bloodstream. Higher the glycemic index, bad the food is. Lower the glycemic index, that much better the food is. So simpler the carbohydrate that you eat, bad it is. More complex the carbohydrate that you eat, it's good. Millets is good because it will take time for millets to get digested. So the entry of carbohydrates or glucose into the blood will be slow and gradual. Ragi is best. Ragi is finger millet. Ragi is best because ragi digests very slowly. It has a lot of fiber. The digestive enzymes have to break it and do a lot of work to break it. So longer period of time the blood glucose level will be maintained at a not so high level. It's very important to maintain it that way. If let's say you see the requirement of glucose by the cells, is it intermittent or is it continuous? The requirement of glucose by the cells, is it occasional or is it continuous? Do they require glucose continuously or do they require glucose every now and then? Cells. Do the cells require glucose continuously or do the cells require glucose every now and then? Every now and then. So in between that, metabolism will be shut off, like the projector. You have to think, why is glucose required? For producing energy for metabolism. Metabolism is chemical reactions. So the same question will be, are the metabolic reactions happening in the cell continuously or are the metabolic reactions in the cell happening every now and then? Are metabolic reactions happening occasionally or continuously? Continuously. So if metabolic reactions are happening continuously, is the demand for energy in the cell continuous or occasional? Continuous. If the demand for energy in the cell is continuous, is the requirement for glucose continuous or occasional? Continuous, no? So you have to build it from somewhere. If the demand for glucose is continuous, then the availability of glucose in blood should be always present or come and go. Should the glucose be always present in the blood, or should the glucose come and get out of the blood? It should always be present in the blood. That is what we refer to as fasting blood glucose, 70 to 100 milligram per deciliter of blood. Even when you wake up in the morning, you check for your blood glucose level, it will be between 70 to 100 milligram per deciliter of blood. If it goes below that, you will have a hypoglycemic shock. You will have hypoglycemia, you will have giddiness, you will fall down, metabolism will stop. Alright? So, glucose level has to be there. Glucose has to be there. You will not be able to completely remove glucose. Now, coming beyond that, is insulin clearing glucose above the baseline, or is insulin clearing all glucose from blood? Does insulin try to remove every glucose from blood, or does insulin try to remove excess glucose from blood? Excess glucose from blood. So let us say till 140 or 120 to 140 is the level, beyond which insulin will become very aggressively, insulin will be produced in higher quantities and it will push it into storage. Now if you don't want the carbohydrate that you eat to go into storage, your target is keep the blood glucose level between 100 to 120. If your blood glucose level is between 100 to 120, then most of the glucose that is available in that range will be utilized by the cells for metabolism. Yes or no? When you eat a heavy meal, what happens? There is a lot of carbohydrates that you consume and there is a lot of glucose that enters the blood. When a lot of glucose enters the blood rapidly, what will be insulin production? Will it be more than normal or same or less than normal? More than normal. More insulin means what? More faster removal of glucose from the blood. More faster removal of glucose from the blood means what? More rapid fall of glucose to the baseline or below. So when you wake up, insulin would have made everything that you have eaten, every glucose that has entered into the blood get pushed into storage. Then you wake up hungry. So if the level of glucose go down below the baseline, then has it happened that there is a festival at home, lot of preparations going on, you know that you will get food only after all the celebrations and prayers. Festival is supposed to be a happy event, but you know that you will not get breakfast. You are not sure of getting lunch also. You know what you are getting is a feast. But when is the question? When you are anticipating a feast but you are not getting it, your hunger increases. Around 8:30, 9 o'clock in the morning you are very hungry. Your parents don't seem to be completing what they are supposed to complete so that you can eat. Hunger goes to a peak and within a few, and generally by the time you get to eat, you are no longer hungry. You are waiting to eat everything that you can get your hands on. But after that period of intense hunger and struggle and sleeping off for a while and then getting up, you are no longer hungry. You eat only little quantity. What happened in between? What happened in between? Glycogen is converted into glucose. By whom? Who initiated that? Glucagon. So these two are counter hormones. Insulin decreases blood glucose when the blood glucose level is higher than normal range. If the blood glucose level goes below normal range, glucagon will bring out glucose into blood. So both of these fellows maintain the level of glucose in the blood at an optimum concentration. Alright? Maintaining glucose optimally is very, very important. Managing glucose metabolism is a key to managing weight. Eating complex carbohydrates, completely eliminating processed carbohydrates is the most important thing to be done to manage weight. Complex carbohydrates will keep your energy high for a longer period of time. You don't feel hungry. So the quantity of food that you eat will be reduced and the frequency will be reduced. If you eat very complex carbohydrates with a lot of fiber. If you completely eliminate processed carbohydrates, like anything with added sugar is a problem. Anything with added sugar is a problem. Fruits is not a problem because fruit, though they have simple sugars, they are not only sugars. There are a lot of fibers, there are other things also associated with it. So it will also take some time to digest. Alright, the sweetness is not only because of sugar in it. So fruits are fine in moderate quantities if you are managing weight. Anyways, let's not go into that tangent. Metabolism, I told you two hormones that you have to look at, keep in mind is insulin, glucagon, both produced from the pancreas. This is for making sure the body is alive. Insulin and glucagon is important to maintain your basic metabolism and it will keep you alive. There is another pair of hormones which will help you maintain your muscular function. Musculoskeletal function, musculoskeletal metabolism is dependent on a pair of hormones called calcitonin and parathormone. Calcitonin and parathormone. Calcitonin is produced by? Who produces calcitonin? Thyroid gland. Thyroid gland produces calcitonin. Parathormone is produced by parathyroid glands. It's produced by parathyroid glands. Both of these are responsible for maintaining calcium levels in the blood. Alright? Why calcium level? Yesterday while studying muscle I told you, calcium is necessary for muscle contraction. If calcium is not there or calcium is low in concentration, muscle function will be affected. So that will also threaten your survival because muscles being optimally functional is necessary for overcoming dangers. So that's a protective mechanism that we have. So calcium. Regulating metabolism means what? Something will increase the level of a particular thing. Its counter hormone will decrease it. So calcitonin and parathormone are counter hormones acting in opposite directions on the same process. The process is calcium levels in blood. What it acts on is calcium levels in blood. Calcitonin will decrease calcium levels in blood. Parathormone will increase calcium levels in blood. So you know if parathyroid gland becomes hyperactive and if there is hyperparathyroidism, what problems can you anticipate? Tell me something that can be observed in a person with hyperparathyroidism. What can be observed in a person with hyperparathyroidism? Hyperparathyroidism means what? Parathyroid hormone is produced in excess quantity. Parathyroid hormone is produced in excess quantity. If parathyroid hormone is produced in excess quantity,
You have strong muscles. Strong muscles.
you'll have strong muscles. So if you find a very strong muscular person, you mean to say he might be hyperparathyroid? No? Okay, suppose, tell me, is strong muscles because of calcium? Calcium is required for muscles to function. If there is no calcium, the muscle will not function properly. But if you give more calcium, will the muscle pump up? That requires training. Okay? What might we see? That person might be prone for more fractures. Why? Where is the excess calcium in the blood coming from? Parathyroid hormone will go and start scraping off bones. It will start scraping calcium from bones. It will be demineralizing the bones. Alright, with hyperparathyroidism, demineralization bones happen and bones can become brittle. Brittle bones are a risk factor for fractures. Alright, so suddenly it's possible, no? Elderly, why do we see? They're just walking, slipped in the bathroom, hip, neck of femur fracture. Femur is the strongest bone, but as age progresses, there will be osteoporosis. Osteoporosis is bones becoming brittle. And because of osteoporosis, the bones would become weak and a small impact also can lead to fractures. Otherwise, how many times as children we would have fallen? While riding bicycle, running, stairs. So many times younger people fall and they will get up and they keep moving. But elderly people, they'll have fractures because of the weak or the softened bones, demineralized bones. Alright. So growth and development we saw. Metabolism, these two pairs of hormones we saw. Reproduction. Metabolism, again, there are other things, other gland functions. See, pituitary hormones, there are a lot of trophic hormones. Trophic hormones means what? TSH, thyroid stimulating hormone, adenocorticotropic hormone, follicle stimulating hormone, luteinizing hormone. These are all trophic hormones. Trophic hormones are those which will stimulate something else to produce their functions. ACTH, adenocorticotropic hormone, will stimulate the adrenal cortex to produce its own hormones. It is not having any other direct influence on another organ or gland. TSH, thyroid stimulating hormone, its job is to tell the thyroid gland to produce thyroxine. It will not produce thyroxine. Okay. So those two are trophic hormones. FSH, LH, FSH, follicle stimulating hormone, stimulates what? It will stimulate the maturation of, it will stimulate the growth and development of ovarian follicles. Okay, ovarian follicles. What is the name of the scientist associated with the ovarian follicle? Graafian follicle. Graafian follicle or the ovarian follicle. So it's associated with the reproductive cycles in the female. We will see that when we get some question related to reproduction.
So I have one question.
Yes.
Does the production of energy and use of energy occur at the same time simultaneously?
Yes. Yes. Production is all of that can happen. All the chemical reactions, all the metabolic reactions can go on parallelly. Alright. Okay. We'll just go one by one now. I'll just take it up with growth. Growth hormone has another hormone that supports. It is not a hormone in the true sense, but a hormone like chemical which will promote the effect of growth hormone. Alright, it is called insulin-like growth factor. Insulin-like growth factor, but it is not produced by pancreas. Insulin-like growth factor is produced by the liver. So it mediates the effects of growth hormone, promoting cell growth and development. T3, T4 we saw. Growth for growth, T3, T4 also contributes. Regulate overall growth, development and metabolism. For development, I told you thyroid hormone, estrogen, testosterone, thymosin are also for development. Estrogen develops what? The follicles. The follicles which are produced in the ovary needs to have the influence of estrogen, progesterone, FSH, LH. Progesterone will be produced by itself later. Estrogen, follicle stimulating hormone and luteinizing hormone. These are the three hormones which will help in the growth and maturation of the follicles. A follicle which has released the ovum, will have the production of progesterone. So associated with reproduction, there are a lot of hormones which we will have to see in the context of reproductive function. Right now we will just make a list of those. Okay? When we get a question related to reproduction, we will deal with that. So for the development of ovarian follicles, for the development of ovary and for the development of reproductive functions, it will be estrogen beginning. The early stage follicles will also start producing estrogen. Estrogen is the first hormone that will be produced by the follicle. Testosterone promotes the development of male secondary sexual characters. Testosterone is produced by the testes. Which cells of the testes produce testosterone? Sertoli cells. Sertoli cells. Alright. So we will look at it again. When we get some question related to reproduction, we will deal with the hormones also. Thymosin. Thymosin is produced by which gland? Thymosin is produced by thymus. Where do you have thymus in your body? Where do you have thymus in your body? Where do you have thymus in your body is the question. Option A, at the base of the skull. Option B, behind the sternum. Option C, behind the liver. Option D, nowhere. Behind the sternum. Huh? Behind the sternum? Sure? I'll repeat the question. Where do you have thymus in your body? Base of the skull, behind the sternum, behind the liver, nowhere. Behind the sternum? Those of you who say behind the, at the base of the skull, raise your hands. Base of the skull, nobody. Behind the sternum, raise your hands. Thymus is present behind the sternum in your body. Right? When I said behind the sternum, you raised your hands. When I said in your body, you are putting your hands down. It's the same. Those of you who say behind the river, nobody. Those of you who say nowhere, nobody. Nowhere. Why? Just for the sake of representation. Right? When nobody is selecting nowhere, I will choose it so that if I win, I am the only one, no competition. Okay. Thymus is an organ which produces thymosin. Thymosin is instrumental in acting on the bone marrow and bringing about the maturation of T lymphocytes. T lymphocytes is production and maturation of T lymphocytes is stimulated by thymosin. But thymus is an organ, is a gland that degenerates at the onset of puberty. At the onset of puberty and post-puberty, there is no thymus in the body. You will have some fibrous tissue behind the sternum, which is like telling that there was thymus here. There is no sternum in your body. There is no thymus in your body at this point of time. Thymus has degenerated completely. Once upon a time, you had a gland called thymus, which was responsible for making your body capable of fighting infections. But today, it's no longer there. It has been martyred. Okay? Thymus has been martyred long back in your body. It came, it did its job, and it went away silently without even letting you know. And you continue to enjoy the benefits of what thymus did. Okay? Metabolism, thyroid hormones we discussed, insulin, glucagon we discussed, cortisol is important. Cortisol regulates the metabolism of proteins, fats and carbohydrates. It leads to stress response, suppresses inflammation. Cortisol is the steroid that we often talk about. Cortisol is the steroid that we often talk about and abused medically. You go to doctors are supposed to give you steroids when there is necessity. Steroids are considered to be magic drugs. They will reduce inflammation. They will bring about an anti-inflammatory response, reduce inflammation, make the person feel good, increases glucose metabolism, makes more energy available. So steroids will make the person feel good and feel like the disease has gone away. Inflammation is a necessary reaction of the body in the fight against infections or injury. Steroids will reduce inflammation not necessarily removes the injury or infection. So the injury and infection will remain. Steroid is masking the inflammation. The response might get affected. Steroids can be given as a part of treatment when other causes of the disease are also being treated. Steroids will act in making the patient feel good and feel less discomfort during the course of treatment. Alright, so it's very important to know that. Cortisol is also the stress hormone. When we are stressed, the glucocorticoids are released in the body. That is, the cortisol is released in the body. That will lead to increasing in the ability of the tissues to take up glucose. Stress hormone makes the cells and tissues capable of taking up more glucose. To make you feel good. More glucose means more metabolism of glucose, more energy, you will feel good. You will have the energy to fight stress. Stress is a situation of survival threat. Emotional stress or physical stress, situation of danger. The body will look at all of that in the same way. The intensity of stress is dependent on how threatened you are feeling. And the sensation of threat or the feeling of threat is not necessarily directly related to the actual threat. It's a perception, it's like pain. Somebody might have a thorn prick and dance and jump and cry like their limb has been severed in a bomb blast. Somebody might have actually been in a bomb blast, the limb might be hanging, they might just be backing it up and still walking to fight. You've seen that? At least in movies we have seen. The soldiers who are trained, soldiers who are trained to fight, they are injured, but they are still holding on. But common people, some people will overreact or react in a hyperactive manner. We cannot say overreact. Reaction is a reaction. Alright? Pain is a perception. It is not necessarily dependent on what is the actual injury. Similarly, stress is also a perception. It is not necessarily dependent on the actual threat to survival. But the response to stress is always cortisol. Adrenal gland produces this cortisol, and this cortisol will, how does it make the body capable of fighting stress? When you are stressed out, when you are under stress, your life is threatened, you need to have the resources to come out of the situation which is threatening your life. Correct? So the influence of anything that will help you to do that, the steroid that will help you to do that is, it should help you reduce anxiety. So it should act on your brain centers. It should act on your brain also, it should help you reduce anxiety. It should help you relax your muscles. It should help you relax your muscles and also give enough energy available for the cells to increase metabolism if there is a need for an escape response. If there is a need for an escape response, your body should be capable of utilizing every bit of energy that is available. So absorption increases, the utilization of energy increases. Muscles should be supplied with more energy so that if there is a the blood circulation redistribution can happen. Alright, you understanding? Think of a situation when there is a threat to survival and somebody is preparing the body to fight it or overcome that situation. That is what cortisol does. The impact of that is, see, in the short term, when there is a threat, short term it is beneficial, very good. It is a protective mechanism. But if there is a continuous stress, you are stressed out, you are worrying about something, you are constantly under emotional stress, you are overthinking, all of that will be still perceived as survival threat only by the body, and the response is cortisol, and that continuous influence of that will start making the metabolism become slow. It will slow down the metabolism, it will make the person put on weight, lethargy, cloudiness of thinking. So many changes will happen. So that is the steroid. Epinephrine increases, epinephrine is also referred to as adrenaline. Norepinephrine is referred to as noradrenaline. Alright? Adrenaline and noradrenaline. Epinephrine, norepinephrine.
So are they counter hormones? Are they opposite from each other, like functions?
What do you know?
No, adrenaline and adrenaline.
Noradrenaline and adrenaline?
Are they counter hormones?
No. They are similar in function. Adrenaline and noradrenaline does the same thing. Okay? Norepinephrine or noradrenaline works with epinephrine to increase blood pressure and heart rate during stress. Okay? They are sympathetic stimulation hormones. Adrenaline and noradrenaline are released when there is sympathetic stimulation, so they are under neural control. Increases, think about it like what will be the effect of adrenaline and noradrenaline? It is the same as what will happen during sympathetic stimulation. You finish your exams, you go back home, you would have become very good friends. It's like 1 year Big Boss. Minus the fight for food. You're still getting food. So you all decide that we will meet up again, we will meet up in our own respective districts, or you meet up. You go for a second show movie, a horror movie, and by the time you come out, it's raining. Meghalaya, anytime we can rain. Okay. It's raining and it is dark. It is the new moon day, Amavasya. You come out of the movie because of rain. There is no power cut. You are not getting any public transport, no cabs available. You are walking in a small group. There are sounds coming from here and there. You are already afraid. Some 2-3 people start moving towards you to rob you. At the same time, a bunch of dogs are coming running towards you. The dogs in the front are looking at you like saviors because 10 dogs are chasing them. You are looking at 12 dogs coming towards you. Now what happens at this time is sympathetic stimulation. Imagine the body's response during this time, and whatever happens is the influence of sympathetic stimulation on the body. What is the effect of sympathetic stimulation on heart rate? Heart rate increases. What is the effect of sympathetic stimulation on depth of breathing? Depth of breathing decreases. Breathing becomes shallow. Rate of respiration, rate of breathing increases. It will be as fast as the dogs chasing you. Okay. So, anyways, we will not deviate from there. Epinephrine, norepinephrine have similar effect. Adrenaline increases heart rate, blood pressure, energy supply during the fight or flight response. Fight, flight, fight response. Fight, flight, fight is the sympathetic response. Aldosterone is also produced by adrenal gland, regulates sodium and potassium balance, which indirectly influences water balance and blood pressure. Aldosterone increases sodium retention. So it increases blood pressure. It can retain sodium and increases blood pressure. Alright. So blood pressure regulation can happen with aldosterone. Aldosterone increases sodium retention. There is one thing called ANP, atrial natriuretic peptide, which will increase sodium excretion. There is one hormone of posterior pituitary, which will increase water absorption from the urine. What is that hormone which will increase water absorption? ADH, antidiuretic hormone. Antidiuretic hormone increases water absorption. So of the metabolic things, the metabolism that we discussed, glucose metabolism taken care of, calcium metabolism taken care of, sodium metabolism is also important. Calcium is for muscles. Sodium is very important for managing blood pressure. So absorption of sodium and excretion of sodium also should be regulated. And fourth, absorption and excretion of sodium regulated by two hormones. One, aldosterone increases absorption. ANP, atrial natriuretic peptide, increases excretion. Atrial means heart, of the heart. Natri is natrium, sodium. Uretic, urine. Peptide, it's a peptide hormone. Atrial natriuretic peptide will cause excretion of sodium from the kidneys. So, metabolism, you have to regulate energy metabolism, insulin, glucagon. You have to regulate calcium metabolism. What are the hormones? What are the hormones for calcium metabolism? Name the hormones that are regulating calcium metabolism. calcitonin and parathormone. You have to regulate sodium metabolism. Which one? Sodium. Aldosterone increases sodium absorption. Adrenal natriuretic peptide increases sodium excretion. Alright? Calcium for muscles, sodium for blood pressure, then water. Water. Who regulates water retention or water excretion? ADH, antidiuretic hormone. So these four you take care of, metabolism is reasonably maintained. What is the opposite for aldosterone, ADH, antidiuretic hormone? You don't need to have any, because in the kidneys, excretion happens. You reduce the concentration of ADH, the urine becomes more dilute. You increase the concentration of ADH, urine becomes more concentrated. So you are regulating with one hormone only. Calcitonin, parathormone we discussed. Reproduction, FSH, LH, estrogen, progesterone. Testosterone also we discussed. Prolactin, oxytocin. See, I'll tell you four hormones. You have to tell me which one of those are exclusively female. FSH, LH, estrogen, progesterone. Okay, oxytocin. 5 hormones. FSH, LH, estrogen, progesterone, oxytocin. These are the 5 hormones. Of these 5 hormones, which ones are exclusively female in their presence? Is FSH present in females? Is it present in males? Yes. Is LH present in females? Yes. Is LH present in males? Yes. You can call it by other name. But FSH and LH are present in both males and females. Is estrogen present in females? Is estrogen present in males? No, because estrogen is produced by the follicle. Is progesterone present in females? In males? No. Because progesterone is also produced by a mature follicle, the hydratic follicle or the lutein follicle. Then is oxytocin present in females? Oxytocin in males? No. Is pituitary present in males? Is pituitary present in males? Yes. Oxytocin is produced by posterior pituitary. So, whatever is produced by pituitary should be produced in all humans, no? Exclusive structures of male and female produces certain things can be exclusive to male and female respectively. Pituitary, if you have confusion there, oxytocin, definitely in females it will help in childbirth. Oxytocin is present in males also. Oxytocin brings about smooth muscle contraction. So it is required in males also for various smooth muscle activities. Alright, anyways, next thing. Prolactin. Prolactin, is it present in females? Yes. Is it present in males? Prolactin is produced by anterior pituitary. Present in males also. But I told you nothing happens just like that. Because there is prolactin producing cells in the pituitary of the males also, it will not start producing prolactin because it needs to get stimulus for that. It is not getting stimulation. If there is stimulation for the prolactin production, then there will be prolactin production also. Okay. Oxytocin done. Diseases. We will just see the names of the disease. We will not go into the details. Let us get a question related to diseases, then we will do diseases. Growth hormone. Overproduction of growth hormone in children. Gigantism. Overproduction in adults. Acromegaly. Overproduction, underproduction in children. Dwarfism. Underproduction in adults will not have much impact. Though the skin tone and texture can be altered, but otherwise we don't call it by any name. Thyroid hormone overproduction, hyperthyroidism, Graves' disease. I told you, Graves' disease is an autoimmune hyperthyroidism. Exophthalmia, yesterday I told you exophthalmia, the eyeball becomes bulged out. Eyeball doesn't bulge out, it is because the fat padding in the socket will be eaten up. The fat padding will be eaten up, making the lid to retract. Exophthalmia is because of lid retraction and not because of eyeball protrusion. But whether it is lid retraction or eyeball protrusion, eyeball appears to be protruded. Okay. Hypothyroidism, cretinism in infants, myxedema in adults. Cortisol. Hyperproduction of cortisol is Cushing syndrome. Hyposecretion of cortisol is Addison's disease. Cushing syndrome is referred to as moon face disease. Neck, fat padding in the neck, round face, accumulation of fluid in the body. Why all that happens, we will see, but just know the names. Hyperproduction, underproduction, hypersecretion, hyposecretion, just the names. Insulin, hypoglycemia if it is overproduction, diabetes if it is underproduction. Diabetes also there are two types, type 1, type 2. Type 1 diabetes is referred to as congenital diabetes or early onset diabetes. Type 2 diabetes is late onset diabetes, which you find in most of the adults. Type 1 diabetes is or insulin dependent diabetes mellitus. Type 1 is called IDDM. Insulin dependent diabetes is because of problem in the insulin producing cells of the pancreas. Type 2 diabetes, or what you find in most of the adults, late onset, is because the insulin receptors on the cells become resistant. Insulin receptor resistance is the cause of type 2 diabetes. Insulin is being produced normally, but the cells, the insulin receptors on the cells are becoming more resistant. Insulin is coming and knocking the door. It's like, then what will you do? How will you treat? You give all those medication. No? Anybody having diabetics at home? Nobody. So, healthy population completely okay. Some of them have diabetics at home. You don't see diabetics taking insulin injections, no? Generally, unless it is later stages of diabetes or it is not responding to medication tablets. What tablets they take? Glimepiride, metformin, whatever those tablets they take. Most of these tablets are insulin receptor stimulants. They will try to make the insulin receptors more sensitive. Increases the sensitivity of insulin receptors. Thereby making the insulin that is there in the body effective in making the cells take up glucose. Okay. Can diabetes why will there be hyperglycemia in diabetes? Hyperglycemia. Hyperglycemia is increased glucose in the blood. Why will there be hyperglycemia? There is not enough production of insulin. Okay. Whether it is due to low production of insulin or resistance to insulin in the receptors. The glucose in the blood is not being able to pushed into utilization or storage. You are not able to push glucose into either utilization or storage, making the glucose level remain high. Cells are crying, cells are sending signals that I don't have food, I am starving. That will be interpreted by the brain as hunger, triggers hunger. The person eats more, adding to more glucose in the blood, further hyperglycemia. Not only that, cells are telling that there is not enough glucose for me to eat, that signal can trigger glucagon production also. Even if the person doesn't eat, glucagon will start bringing in more glucose into blood. So we see uncontrolled diabetes can go into diabetic ketoacidosis. Diabetic ketoacidosis is extreme levels of glucose in the blood. Cells are not able to utilize glucose. When cells are not able to utilize glucose, they will start utilizing fat for energy needs. They will break down fats. When fats are being broken down, the byproduct of fat metabolism is ketone bodies. Ketone bodies will start accumulating in the blood. There is hyperglycemia. Added to that, ketone bodies are getting into blood. This becomes toxic for the cells. So that toxicity can lead to multi-organ failure and death. 400, 450 milligrams glucose in blood can be the time when you have to worry about ketoacidosis. Okay. I used to work in the intensive care and emergency medicine department. So one evening, a 12-year-old girl was admitted. She got admitted, type 1 diabetes, insulin dependent diabetes patient. Glucose level was 400, 450. She was admitted into the ICU, treated. She was good. One day she was well, shifted to the ward. Next day morning she had a bit of giddiness during night. In the ward during the night time, her glucose has spiked, and as her body had gone into ketone metabolism, she started feeling a bit giddy. BP was altering. 2 minutes by the time she was shifted from ward back to the ICU, she was dead. 12-year-old girl. Talking happily 10 minutes ago, collapses and dies within 10 minutes. Such a painful situation. Type 1 diabetes was the case. Anyways, so how body turns up, how the reactions happen, how we, despite doing anything, things can go out of control. It's all dependent on how the body is responding. So even as a doctor, you are doing everything within your capacity. But what you do will be successful if the body is responding. The body doesn't respond, you are at loss. You don't know what is happening. Alright. So beating up doctors for patients dying is senseless. There are a lot of things that can go wrong which doctors cannot even control. Okay. Anyways, why did we go into ketoacidosis? I wanted to ask you something. Can diabetes lead to hypertension? Often you see diabetic patients will be hypertensive also, generally. There is a possibility that it's not that everybody should be, but generally diabetics whose diabetes is not controlled well will also be hypertensive. Hypertensives need not necessarily be diabetics. So the number of people with only hypertension will be much more than the number of people with only diabetes. People with diabetes, a larger proportion of them will also have hypertension. Not the case with hypertensives. There can be people with only hypertension for a lifetime, but people who are not managing their diabetes well will eventually become hypertensive also. Why is a question you have to think. Let the question come about the timelines. Alright. This is all done. Testosterone, adrenaline, TSH. Okay. Testosterone in excess and all that, let's not bother. Hyperadrenalism is pheochromocytoma. There is no disease for low adrenaline. Hyperthyroidism due to pituitary adenoma, TSH. Hyperthyroidism, hypothyroidism. If LH is low, it can lead to infertility, hypogonadism, FSH low, infertility. This you have to remember. Hyposecretion of ADH. This is a question. This has not appeared much. Cushing syndrome is question. Cushing syndrome, Addison's disease. Question. Diabetes mellitus, diabetes insipidus. Question. Insipid means what? Tasteless. Mellitus, diabetes mellitus is also referred to as sweet urine disease. Who named it? I don't know. But somebody has named it as sweet urine disease. May not be because of the taste of it, but because of the presence of glucose in it and people's experience of knowing that glucose is sweet. So, diabetes mellitus is referred to as sweet urine disease. Diabetes insipidus is because of low ADH. ADH is antidiuretic hormone, and if antidiuretic hormone is lesser, then the person will have diuresis. Correct? No? Diuresis is excessive urination. Double urination. That means there is more urination. There are three symptoms of diabetes. What are the three symptoms of diabetes that the patient will come to you with? Polyuria, first one. If somebody is telling you that they keep waking up in the night to pass urine, possible that they are diabetic. Polyuria, polydipsia, polyphagia. Polyuria is excessive urination. Polydipsia is because they are losing so much water, more thirst. Thirst is not only because they are losing water, because increased blood glucose is increasing the specific gravity of blood. It is increasing the thickness of blood, specific gravity of blood, triggering thirst reflexes in the brain, telling you to drink more water so that the blood can become balanced in its specific gravity. Then the third one is polydipsia, polyphagia, more hunger. So the most common symptom of diabetes is polyuria, excessive urination. If ADH is also produced in less quantity, if antidiuretic hormone is produced in less quantity, that will also lead to excessive urination only, no? ADH is required to reabsorb water from the urine and make the urine concentrated. If ADH is low, urine cannot be concentrated as much as it should be. That means there is more volume of urine being collected in the bladder. That means the frequency of urination will increase, which is the same for diabetes also. Not the mechanism, but the symptom. Okay. But because this urine, when you send this urine for examination, there is no glucose found in this urine. That is, so sweet lime soda is like diabetes mellitus urine. Diabetes insipidus urine is salt lime soda. There is no sweet, there is no sugar in it, only salt. Alright. I actually drink lime soda without sugar. So suddenly this diabetes insipidus, I got an image of a glass of lime soda without sugar. There are so many such references. There used to be a disease. Even now, recently we had reports of that disease surfacing, a killer gastroenteritis. What is that gastroenteritis which used to kill people? Cholera. Cholera used to be a food poisoning, gastroenteritis, which used to kill people. Diarrhea, excessive diarrhea. You know how to describe? The description for diarrhea of cholera is rice water diarrhea. Rice water diarrhea. Excess quantity. Like what is rice water? You cook rice with excess water and you drain the water after the rice is cooked. You drain the water. So the water that you get after that you drain off from the cooking rice is rice water. Diarrhea appears like that. I don't know why they could have given name to describe diarrhea in scientific terms. Why should they have to correlate it with rice water? But that correlation will never make you miss how it will be. And there is one more kind of sauce called anchovy sauce. In a particular infection of a fungus in a sexually transmitted disease, the pus is described as anchovy sauce pus. Pus appears like anchovy sauce. So, you should be okay to be not disgusted about the things that you like, you eat, you have, being related to some random dirty things. Okay, I think this is enough for endocrine system for now. There is much more that we have to do, we will do it eventually. Figure shows a diagrammatic view of the human respiratory system with labels A, B, C, D. Select the option which gives correct identification and main function and or characteristic. So you have to identify and correlate the function. Tell me what ABCD is and tell the function. What is A in the diagram? Trachea, what is its function? It's a conducting passage. It's a tube that will conduct air into the lungs. Then what is B? What is B? Pleural membrane. B is pleural membrane. What is its purpose? What is the purpose of pleural membrane? To reduce the friction on the lung surface. Okay. Why will there be friction on the lung surface? Why will there be friction on the lung surface? What is it rubbing against? Pleura is the, I told you that the other day when we discussed the last time, I told you that pleura is what will connect the lungs to the inner wall of the thorax, inner thoracic wall. So the movement is happening of the thorax, not of the lungs. That movement needs to be transmitted to the lungs. How do you transmit it? Via the medium of the pleura. So pleura is a double membrane, double layered covering around the lungs, which will protect the lungs as well as connect the lungs to the thoracic cavity. So when the thorax expands, it pulls the outer layer of the pleura or the parietal pleura, which will pull the fluid, which pulls the visceral pleura being attached into the lungs, pulls the lungs. Lung expansion and contraction is mediated by contraction is still fine because when the thorax is squeezing, the volume as such is decreasing, so there is a compressive force on the lungs. But expansion needs pull, and that pull can happen only with the pleura. It has a fluid in between the two layers, pleural fluid. There is a chemical inside the lungs which will reduce not friction but surface tension. Because you said friction, I will touch upon that and let us see. What is the fluid inside the lungs? What is the chemical inside the lungs which will reduce surface tension of the lungs? Lecithin, or it's also phosphatidylcholine. Phosphatidylcholine. What is it called? For its function of reducing surface tension, it is referred to by a term. Surfactant. Surfactant. Why will there be surface tension? Any surface proportionate to the extent of exposure will have some tension that accumulates because of the contact with the surroundings. Lungs has a large area of exposure. The alveoli is a huge network. To reduce the tension that is generated because of the contact with the surrounding structures, the surfactant will act as the friction or the surface tension reducing agent. Surfactant is the surface tension reducing agent, phosphatidylcholine. Alright. When does it form? When does it develop? A baby which is born before 28 weeks of pregnancy is referred to as premature baby. Baby born after 28 weeks of pregnancy up to 37 weeks of pregnancy is called, up to the date of delivery what is expected is called preterm baby. But before 28 weeks is called premature baby. What has not yet matured with the baby? The survival chance of a premature baby is lesser than a mature baby, but even if it is a preterm baby. So if there is some stress that is threatening delivery, threatening an abortion or a delivery at 27 weeks. Every day that you can push the baby's survival inside the mother's womb increases the chances of survival of the baby drastically. So we will push getting the baby delivered. Crossing that 28 weeks mark is very important. Then you can feel like, okay, we have a better chance of making the baby survive. What is happening around that week which is so significant? Surfactant develops in the lungs at around 28 weeks of pregnancy. So a baby which is delivered before 28 weeks of pregnancy is at a risk of lung collapse. And death. So to keep the lungs inflated, you will have to keep the baby on a ventilator support for some time. That ventilation because on the ventilator increases the risk of infection for the baby, risk of other damages to the baby's body, lungs also. So surfactant develops at around 28 weeks. Surface tension reducing agent. It is not on the surface of the lungs, it is inside the lungs. Okay. Steroid. Okay, if the baby is a premature baby, if you inject steroids into the baby's body, surfactant production will get accelerated. But a premature baby, 28 weeks, there is one more organ which is maturing at around 28 weeks. Thyroid. What will happen if, and steroid will suppress thyroid. Look at it. A baby is born before 28 weeks. Surfactant is not developed. The baby might die of lung collapse. You give steroids, surfactant development will happen in the lungs, but that will act as a thyroid inhibitor. It inhibits thyroid. Thyroid hormone is required for brain maturation. Now, do you want to let the baby die because of lung collapse? You want to make the baby survive by injecting steroids to develop the surfactant? You risk mental retardation in the baby because of thyroid suppression. What do? It's a delicate situation. Correct? This used to be the challenge of helping premature babies survive in earlier days. Now, there are technologies available, even babies born at 25-26 weeks also survive. Because of the advancement in the medical care, advancement in the health care, even babies born prematurely also survive without putting the baby at the risk of thyroid inhibition and mental retardation. See, all this understanding that you have, with the basic understanding that you get from whatever I have discussed now, if you start thinking and applying your mind and looking at problems and trying to figure out why it is happening, some solution will appear. What can be the problem with this solution? The solution is helping you tackle this problem. But is the solution a problem for something else? Then that might be something. So how do I do? Can I avoid this solution to not have this problem? If this solution is unavoidable, this I have to do, then you have to think, how do I tackle this? So it is not just read from a book and do something. Dealing with biological systems is very, very complex compared to dealing with physical systems. Physical systems, the parameters are identifiable. Physical systems, the parameters, the variables can be controlled, and you can predict the outcome. Biological systems, you cannot predict the outcome. Biological systems are dynamic systems. Dynamic systems which will respond to the same thing in different ways at different times in the same person. Alright? So, if you are bad with logic, if you are bad with analysis, if you are bad with calculation, if you are bad with mathematics, become a doctor. If you are good with your ability to memorize, wrong. If you are good at everything, become a doctor. Okay. If you are good at calculation, if you are good at logic, analysis, application of mind, problem solving, become a doctor. Then you will be able to help people. Lot of judgment is required. Small things, keen observation. Alright. Nothing like anything else requires less intelligence. Everything at an impact creation level requires the same kind of superior intelligence. And nobody is born with intelligence and competencies. Everybody has to develop intelligence and competencies. And intellect-wise, everybody is same. You have to train and become capable of doing the things that you have to do in your own profession at the best of your possibility. Those people who say something is better than the other, profession-wise, they are operating at a mediocre level in their profession. Anybody who have seen the higher levels of impact of their profession will be able to appreciate every profession is contributing to great welfare at their higher levels. So in that sense, history, economics, politics, medicine, engineering, psychology, everything at the top level is the same. Alright, everything at the top level requires top class people. Everything will have mediocre people at the lower levels. So which one is a good career, which one is a good choice, which one is a good course, which one is a good branch? Whatever a good person chooses is a good one. That's all, alright. So B done. C, what is C? C is alveoli. D is diaphragm. C is alveoli, D is diaphragm. Alright, done. Okay. Diaphragm is what kind of muscle? What type of muscle is diaphragm? Cartilaginous muscle. What is it? Skeletal muscles or smooth muscle? Diaphragm? Smooth muscle. So involuntary muscle. Is diaphragm an involuntary muscle? Is diaphragm involuntary? Doesn't diaphragm have any voluntary component? Is it a skeletal muscle or a smooth muscle? Diaphragm is a skeletal muscle, a sheet of skeletal muscle. You can control it, no? When you breathe deep, you are making the diaphragm flatten. Okay? The diaphragm has a lot of involuntary component also. It works involuntarily also, but it's a skeletal muscle. Okay. A trachea, long tube supported by complete cartilaginous rings for conducting inspiration. You have to tell true or false for each of the statement. A, B, C, D, the names are correct. Trachea, pleural membrane, alveoli, lower end of, no. Okay, A, trachea, long tube supported by complete cartilaginous rings for conducting inspired air. Is the statement correct? Trachea is correct. Is the statement right? What is wrong about the statement? Cartilaginous rings are not complete. What cartilage is used in the making of these rings? Hyaline cartilage. Alright. Cartilaginous rings are C-shaped, semicircular, C-shaped rings. Pleural membrane surrounds ribs on both sides to provide cushion against rubbing. True or false statement? Is the pleural membrane surrounding the ribs on both sides? Is it on outside and inside of the ribs? It is in between the lungs and ribs. It is in between the lungs and ribs. One part of the membrane attached to the lungs, one part of the membrane attached to the ribs. So, statement D is wrong. Alveoli, thin-walled vascular bag-like structures for exchange of gases. True or false? True. Are they vascular bags? Vascular means what? Anything that is vascular means with blood supply. Is there blood supply for alveoli? There is blood supply for alveoli, alveolar capillary. So the alveolo-capillary membrane is just a two-layered membrane of two layers of squamous cells. It is just a membrane. On the alveolar side is one layer of squamous cells. On the capillary side is one layer of squamous cells. Just two layers of squamous cells separate the air from blood. D. Lower end of lungs, diaphragm pulls it down during inspiration. Is D the lower end of lungs? D is diaphragm. So if it was D is diaphragm, instead of lower end of lungs, it was diaphragm and pulls it down during inspiration. Then it would have been correct. No, it is not a name. So, cartilage design around trachea. Trachea is supported by C-shaped rings of hyaline cartilage. These rings provide structural support, keeping the trachea open for air to pass through the lungs. Why semicircular? Trachea and esophagus are adjacent to each other. Correct? Trachea and esophagus are adjacent to each other. Esophagus is food pipe. Esophagus will have peristaltic movements. That means where the food is passing, the esophagus will expand and it will squeeze the tube. Trachea is just sitting next to it. So esophagus will push on the trachea also. Esophagus will push on the trachea also. If the cartilaginous ring was complete, then what would have happened? While swallowing food, when you are swallowing food, when the esophagus has to expand, there is cartilage preventing it from expanding. Swallowing food would have been difficult. So trachea has given up on half of the ring on the side of the esophagus as a goodwill gesture. See, me not having a full ring is okay, I can still conduct air. For me, I should not collapse, that's all. I should remain open. Let's think about it like a conversation between trachea and esophagus. Trachea forms the full ring. Esophagus comes and says, esophagus is the neighbor. Brother, please, I am not able to expand because of your ring. Can you remove this portion of the ring so that I can also live? Trachea says, no, I cannot do that because I am supposed to be completely open throughout all the time so that air entry happens smoothly. You can push food, boss. I cannot push air. It has to be just open. Master has told that I have to remain like an empty tube, completely open. Esophagus says, but if you don't open this, I will not be able to push food. Both of them have a brainstorming session. At the end of it, they come to a conclusion that, okay, we will remove this portion, engineering, no? This is engineering. We will remove a portion of the cartilage so that on your side, when you want to expand, there is space for you to expand. I provide elasticity for you to expand. And I can still remain open, I can still remain intact. Alright, so the C-shaped cartilage, why hyaline cartilage, why not fibrous cartilage, that we will see later. Alright, there are different types of cartilages also. The importance of diaphragm for breathing, we know that. Pleural membrane and its significance, I have already told you. Structure of alveoli, I told you, one cell thick surrounded by a dense network of capillaries. Both the alveoli and the capillaries are one cell thick. The figure shows a schematic plan of blood circulation in humans with labels A to D. Identify the label and give its functions. Identify the labels A to D and give its functions. Let us see what is the diagram. A, B, C, D. Identify the structures. What is this? What is this? Heart. What is this representing? Lungs. Capillary network in the lungs. What is this representing? Body. The rest of the body. So this is representation of aorta. This is representation of vena cava. Both superior and inferior vena cava. This is representation of pulmonary artery. This is representation of pulmonary vein. So A, B, C, D. A is pulmonary vein, B is aorta, C is vena cava, and D is pulmonary artery. Let us see. A is pulmonary vein. We will just look at that, A, B, C, D. Try to eliminate the wrong ones from that. A is pulmonary vein, correct. B is pulmonary artery. B is pulmonary artery is given, wrong. So you don't have to look at B. Rule out. B is ruled out. C is vena cava, true. D is dorsal aorta, false. So it is between 1 and 3. Pulmonary vein takes impure blood, correct? Wrong. So 1 is ruled out. Option 3 should be the right choice. You don't even have to know the partial pressure of oxygen in different structures. Go from where you are and try to eliminate the wrong ones by the guarantee of what you know. Correct? So before even looking at it, before even looking at the options, you just fixed in your mind what is ABCD. You fixed in your mind what is ABCD, and you try to look at the options to select only those options which are marking A, B, C, D respectively correctly. In that we eliminated 2. Option 2 and option 4 were eliminated. Then the options are talking about carrying impure blood, carrying blood from where to where and all that. Circulation related things are there. Pulmonary vein is carrying impure blood from body parts. Gone. Pulmonary vein carries oxygenated blood. We should not call it impure and pure blood, oxygenated and deoxygenated blood. But if a reference comes to impure and pure blood, it is to deoxygenated and oxygenated respectively. Are you all with me in the pace? Anybody losing out? Anybody feeling it is too slow? No? Pace is okay? Not too slow? Anybody feeling too fast? Too fast? Not understanding? If you are not understanding something, stop, ask me. Okay? You can call out like you call out during breaks. Like that. Okay. To get this right, to get this proper, we need to know a few things. We need to know what those ABCD means. That we know. Double circulation, all of you are very familiar with. Then we need to know what each one is carrying. We need to know where it carries blood to and from where we need to know the destination and origin for the blood. That also we know. One more thing that is given in this question is, in each of these structures, what is the partial pressure of oxygen, carbon dioxide and all that is mentioned. So that we need to know. Remember 140, 40, 46 or 40, 45. Alright, 140, 40, 45. 140 is for oxygen, 40 and 45 is for carbon dioxide. Any number that you get should be around this. Any number that you get should be around this. If I say 40 and 45 is related to carbon dioxide, what will be the partial pressure of carbon dioxide in venous blood? 45. Venous blood should have more carbon dioxide. Think about the blood that you are talking about, is it oxygenated or deoxygenated? If the blood is oxygenated, oxygen should be around 100, carbon dioxide should be around 40. If the blood is deoxygenated, oxygen should be around 40, carbon dioxide should be around 45. That's all. Now let's check for the correctness. Pulmonary vein takes impure blood from body parts, PO2 60 mm mercury. Wrong. Correct the statement. Pulmonary veins takes oxygenated blood from lungs to the heart, PO2 would be 100. Pulmonary artery takes deoxygenated blood from heart to the lungs, PO2 would be, this would be 40. Vena cava takes blood from body parts to right auricle, PCO2, see, 45, correct? Dorsal aorta takes blood from heart to body parts, PO2 95 mm mercury. PO2 is correct. PO2 is correct. But dorsal aorta is not taking from the heart. Dorsal aorta is what is in the lower part of the body. It is coming from the lower part of the aorta is dorsal aorta. It is not carrying from heart. It is coming from the arch of aorta. Continuity. So that where is it carrying blood from is wrong, but PO2 is correct there. Alright? This can be confusing. These numbers can be confusing. Some books will give you 102, 104, 46, 48, 45, 44. Around that, what the number should be around is very clear. 140 for oxygen, 40, 46 or 45 for carbon dioxide. Is that clear? Now we will see explanations I have given you. What is partial pressure? Partial pressure is the pressure exerted by a single type of gas in a mixture of gases. It is like the net pressure. All gases are exerting pressure on each other. All gases are exerting pressure on each other. So what will be the pressure exerted by an individual gas will be the pressure created by the presence of that gas in a particular concentration minus all the other counter pressures created by the rest of the gases. That is the partial pressure. So pressure exerted by an individual gas in a mixture of gases. Now if we look at the complete mixture of gas as one unit, that will have some pressure. For the movement of individual gases between two compartments separated by something, the diffusion of individual gases is dependent on how much pressure that individual gas can exert in that mixture. Correct? It is not the overall pressure of that entire gas. It is the pressure created by this individual gas in this mixture. That will determine how the movement happens. So that kind of pressure is referred to as partial pressure. Partial pressure also makes sense because the whole mixture is what is creating the complete pressure. Partial pressure is we are looking at a component of the mixture to determine what pressure it is creating. Why is it important to consider partial pressure while studying gas exchange? I told you that right now. Table of partial pressures. See, I have given you the values which you will find in your textbook. But how to see this, how to interpret this? Alveoli with inhaled air, PO2 should be around 100, PCO2 40. Tissue before receiving oxygen, oxygen will be 40. See, now things move fast because we have already built some discussion around respiration and all that in the previous discussions also. It moves faster. Plant takes a lot of time as your connection with plants is a bit less. Now, diagram given here is the standard ECG of a normal person. The P wave represents what? Three things have to be looked at simultaneously in heart. Or we'll go to PDA formula or PDF formula to heart. What is the purpose of heart? Purpose of heart is to pump blood. Purpose of heart is to pump blood. Clear? What is it made of? Design? Heart is made up of muscle, cardiac muscle. Done. Muscle is a contractile tissue. Okay, super. What is necessary for making the muscle contract? Stimulation. What kind of stimulation is required for muscles to contract? You need electrical stimulation for muscles to contract. Skeletal muscles will contract because of the electrical stimulation given by who gives electrical stimulation for the muscles of the skeleton to contract? Nerves. It is a neurogenic stimulation for the skeletal muscles. The nerves will produce the electricity which will stimulate the muscles. Correct? Or it can be a chemical stimulation also produced by the neurotransmitters. Heart has its own electrical system. It has its own generators. It does not depend on the power supply given by the government. It depends on its own electricity supply because it cannot have the hostel run without power. If you depend on the government, then you are not sure whether you will always have the supply or not. So build your own network of generators. So there is a generator system electrical system in the heart which will produce and distribute electricity. To where? To the different parts of the heart, to all the muscles of the heart. Second, heart is not only pumping blood, it is also receiving blood. Heart receives blood and pumps blood. So to receive and pump, a mechanism has to be created. And because electricity is being generated, electricity is produced, electricity is moving, electricity is a scalar quantity or a vector quantity? Electricity is scalar or vector? Huh? Scalar. Huh? There is no direction for electricity? There is direction for electricity, no? No? Electricity has got no direction? Are you all trying to confuse me? Can we determine the direction of flow of electricity? You have all these thumb rules, left hand thumb rule for electricity, right hand thumb rule for magnetism. It's direction only, no? You are telling the axis of flow, you are telling the axis of whatever. What is this? Coil. This is the axis. Electricity direction can be determined. Now body, let's say here is the electricity. If electricity is being produced here and it is being delivered to this side, from here it is coming here. If I have an electrode which can pick up electricity somewhere here, at this place, electricity is moving towards this electrode, correct? Electricity is being, I'll write it on the board, it will be easier for you to understand. Three things we will see together. Here. Three things we will see together. One is, how is the electricity produced and distributed in the heart? How does the heart respond to receiving electricity? How will the electricity recorded? Electrical activity recorded. This is the record of electrical activity of the heart. ECG, electrocardiogram, record of electrical activity of the heart. Good. So there is heart. Electricity is being produced. There is one generator, two generator, wires between the two generators, one big bundle of wire going down the second generator, splitting into two branches and then splitting into multiple wires supply. For the upper part of the heart, this will only supply electricity to the upper part of the heart. So there is generator number 1 in the upper part of the heart. What is it called? Sinoatrial node, SA node. It is in the sinus of the atrium, sinoatrial node. So that is one generator. There is another generator at the AV junction of atrium and ventricles, junction of the upper and lower chambers of the heart. There is the second generator. These generators we refer to as pacemakers. The sinoatrial node is referred to as the primary pacemaker, the main generator of the heart. Atrioventricular node, AVN, is referred to as the secondary pacemaker. Substation you can call, but it is also generator. It is not just receive and pass station. It will also produce electricity. Alright? That's all. These are the two main things. Generators are there. But every muscle of the heart should be supplied with electricity. Correct? Every muscle of the heart should be supplied with electricity. The main generator, sinoatrial node, will have its wiring to all the parts of the upper part of the heart. The atrium, both the upper chambers, will get fibers from the upper node or the sinoatrial node directly. So whenever this is producing electricity, the upper part of the heart is receiving electricity at the same time. Production is distributing, at the time of production it is distributing. At the same time, from the main generator to the second generator, atrioventricular node, electricity is passed. This fellow is a tube light. He is not like a bulb. He is a tube light. When you switch on the tube light, there is a gap between you switching on the switch and the tube light actually lighting up. Correct? Let us assume you have one switch connected to 10 lights. You have one switch connected to 10 different lights. Possible you can do that? Can you do that? You can do that. 10 different lights are connected to one switch. Of the 10 lights, one is a tube light. The other 9 are bulbs. The fluorescent bulb, let us say. When you switch on the light, will all the lights turn on at the same time? How many lights will turn on at the same time? How many will turn on at the same time? Exactly the same time? As soon as you switch on the light, how many light bulbs will light up? All, including the tube light. How many will turn on at the same time? Switch off the lights. One you switch off. On. This is LED light. This is not the electron chamber tube light. This is LED tube light. On. Off. On. Off. On. Oh, she thought this game will continue, so better to stand. She was trying to stand up now. Okay. No, I think you got used to the game. On. You are not supposed to make the game. What? You want to turn it off? You are here, the light is here. Light is okay. Alright. So imagine that way. When you turn on the switch, all of this will automatically light up because they are LED lights. If you have you seen the earlier tube lights? The earlier ones, that is the electron flow chamber tube lights. You turn on, there will be one choke for that. There will be one starter. It will start blinking. Then it lights up. AVN is like the tube light generator, you assume. It will get the supply, but it will take some time for it to turn on and start producing electricity to fire again. By that time, as soon as the SA node produced electricity, the entire upper chamber received electricity. By the time the AV node starts producing electricity, it is a small gap. So when these fellows, the upper chambers received electricity, they contracted, squeezing out blood into the lower chambers. At that time, AV node was not yet firing. So it was allowing the blood to fill up in the lower chambers. Now this tube light got on and it will also fire. From the bundle of his Purkinje fibers, electricity reaches the lower chambers of the heart. When electricity reaches the lower chamber of the heart, lower chamber will go into contraction, pumping out blood from the lower chambers into the vessels, aorta and pulmonary artery. By this time, what has happened to the upper chamber? They got the electricity, they pumped and they relaxed. It is in relaxation. So, regulating how electricity reaches the different parts of the heart is a way of regulating how heart is contracting and relaxing. Correct? No? When electricity reaches, heart will contract. It is not like you are giving continuous supply of electricity. You just touch and go. Touch, contract, you leave it, relax. So fire, electricity reaches, contraction happens and it relaxes. Because electricity is not being supplied continuously like this. It is a twitch. Fire, electricity reaches the chamber, contraction happens, it relaxes. By that time, AVN got activated, it is firing, lower chambers are contracting, blood is going out of the heart. So, cardiac cycle, that is cardiac cycle, no? When the SAN fires, what will happen to the heart in terms of cardiac cycle? When the SA node fires, what will happen in the cardiac cycle? Atrial systole. When SAN fires, there will be atrial systole. The upper chambers contract. What will the lower chambers be in at that time? Ventricles will be in diastole, because AVN has not yet fired. Now SAN firing is over. Upper chambers contracted and it is relaxed. By the time it relaxes, AVN is become activated. AVN, the lower node has become activated, it will fire, supplying electricity to the ventricles. Now ventricles will go into systole, atrium is in diastole. Squeeze, blood is pushed out and the ventricle is also relaxed. Ventricle is repolarizing, it is recovering. At this time, upper chambers are getting passively filled with blood. They are also in relaxation, the lower ones are also in relaxation before SAN fires again. SAN fires, atria contracts, AVN activated. Atria is relaxing, AVN fires, ventricles contract, ventricles are relaxing. Slight gap, SAN fires again, ventricle atria contract, AVN activation. You see that? Continuously, cycle after cycle, cycle after cycle, it happens. Now, electricity being produced can be picked up. You can pick up the electrical activity, that is what ECG does. When an electricity spike, what will pick up the electrical activity? Electrodes. Have you seen ECG being performed? There are leads that are put. 1, 2, 3, 4, 5, 6, 6 chest leads are put, 4 limb leads are put. One here, 2 at the ankles. 10 leads are put. It's a 12 lead ECG. There are 6 chest leads, 2 wrist leads, 2 ankle leads. 2 are interpreted leads. 2 are derived leads. So those 2 leads are a combination of various leads relating to the electrical activity at a particular position inside the body. So if electricity is moving towards a particular lead, you will find a positive spike. If electricity is moving away from a particular lead, you will find a negative spike. That is why when you read an ECG, different leads will show different types of graph, waveform. Some will be upright, some will be inverted, some will be shorter, some will be taller in amplitude. Based on what the lead is, you will know what should be the nature of activity that you pick up in a normal heart. Based on different leads, you will know what kind of variation is abnormal. All that is beyond the scope of this discussion. Cardiac cycle and electrical activity, did you understand? SAN, AVN, their firing, supply of electricity to different parts of the heart. Is that understood by everybody? Yes? No? Understood? No?
So where do we get electricity from? Where is the electricity coming from?
Where is the electricity coming from? The nodes, this is a good point. Okay, SA node and AV node is actually firing. They are producing electricity. How do they know what they have to produce electricity? That has neural regulation. Alright, the brain is controlling that. The sympathetic nervous system and parasympathetic nervous system is connected to this. Sympathetic nervous system and parasympathetic nervous system will decide the rate of electricity production in the SA node. Okay. For the other parts of the body, they have to depend on the electricity produced by the nervous system. Heart also depends on the electricity produced by the nervous system. But electricity required by the heart is not coming from the nervous system. You understand? Not understanding. Everybody, every other part of the body is like people dependent on food supplied by a let's say supplied by the government. Everybody has to go and eat the food given by the government. Heart is not like that. Heart has its own kitchen. But the government will tell when to cook. You understand? Government is telling when to cook. Heart is not outside the control of the government. Heart is not cooking whenever it wants. Heart can cook in its own kitchen. But the government will tell when to cook. Everybody else are eating what the government is giving. Now consider food as the electricity required for activity of various muscles. For every other muscle in the body, the food is coming from the government. That is, the electrical impulse is coming from the nervous system. But for the muscles of the heart, the food is coming from its own kitchen. The electrical impulse is coming from its own tissue. Understood? Is it clear? So that's a good question. Those kind of questions should come, curiosity based. We are telling all those stories, but where is this coming from? Okay. If you notice, some of the most unanswerable questions will come from small children. You are telling them so many things. Suddenly, innocently, they will ask you something which will make you feel like, correct. I saw one prank. There is one prank, okay. He asked the prankster, the radio jockey pranker who is pranking. He calls. He calls up a lady. He says, something terribly bad happened to me at school today. There was a test given. I was looking into the book and answering the test. I was thrown out of the class. I was accused of cheating and I was thrown out of the class. The lady says, obviously it is cheating only. You are supposed to write without the help of the book. Then she says, oh, what nonsense? Then does it mean a bodybuilder taking steroids to make his own body big is also cheating? She says, oh, what's wrong with you? Yes, it is cheating. Then he says, then it would mean like some athlete taking drugs is also cheating to improve performance. She loses it now. She starts getting angry and says, you might have lost your mind. Then why is it not cheating when you go with makeup to a beauty contest? And suddenly she is like, alright, it is like, correct, no? I had not thought about it that way like till then. If a bodybuilder is not allowed to use external aids to pump his body, an athlete is not allowed to use performance enhancers to improve performance, a student is not allowed to use book to answer a question, answer in the test, how is makeup allowed in a beauty contest? Then it will be a makeup contest. Makeup can make anybody appear however they are possible. Anyways, why did we? Question. She asked, where is the electricity coming to the heart? Okay. We'll just go down a little bit. You will understand. Now see this. I'll correlate this. Okay. This is a spike. Meaning what? Is it indicating electrical activity or no electrical activity? Is it indicating electrical activity or no electrical activity? Electrical activity. This is a flat, meaning no electrical activity at this point of time. There is a gap there. This is a downward spike. What does it mean? Is there electrical activity or no electrical activity? There is electrical activity, but the electricity is moving away from this lead somewhere. Then again it is coming towards this lead. This whole thing is one electrical activity. Then you have a slight gap, then again another electrical activity, then flat line. Then you have a small electrical activity here. Alright? So there are Three main, you see, electrical activity leads to polarization and depolarization. Alright, depolarization and repolarization. When we talk about electricity being moving, the movement is happening because of electricity also there. Electricity is flowing. And at the level of the muscle, what is happening? There is depolarization of the muscle membrane because of the electrical activity. We will do that. We will discuss that when we get a question related to nerve conduction. There is depolarization of the membrane of the muscle, making the ions move. Sodium, potassium, calcium ions shift their positions. They move across the membrane, creating an imbalance in the ionic composition. So after the electrical activity is withdrawn, for the muscle to be ready for another electrical impulse, there should be redistribution of ions back to its original composition. If sodium was more inside, it should come back inside. If potassium was more outside, it should go back outside. That is called repolarization. Depolarization and repolarization both should happen. Depolarization is because of the influence of electrical stimulation. Repolarization is recovery of the depolarized tissue. Alright, depolarized tissue getting recovered is repolarization. So all these activities, all these things will correlate to depolarization, repolarization also. Hello. ಯಾವ ಗಾಡಿ ವೆಹಿಕಲ್ ಇಲ್ಲ ನಮ್ದಲ್ಲ ಅದು ಹಳೆ ಅವ್ರು ಚೇಂಜೇ ಮಾಡಿದ್ದೆ ಹೌದು ಇಲ್ಲ ನಮ್ದಲ್ಲ ನಮ್ದಿತ್ತು ಮಾಡ್ತಿದ್ದೀವಿ ಅವ್ರ ಸ್ಟಿಕ್ಕರು ಚೇಂಜ್ ಮಾಡಿದಾಗ ಹೇಳ್ತೀನಿ ನಂಬರ್ ಅವ್ರಿಲ್ಲ ಸರ್ Our school buses have my number on it. We have sold one bus long back. Those fellows have not removed the stickers. That driver seems to make a lot of traffic violations. Now he has parked the bus somewhere in a no parking zone. Somebody is calling me and scolding, "Hey, why is your bus here? Take it." Okay. Now we'll see this. Just remember this. There is P wave, QRS complex. This is S wave. QRS complex. Then there is a T wave. Sometimes you might also find a small U wave. This is U wave. U is not found normally. So let it be. We will consider P, QRS, T. So three electrical activity we are coordinating. We are correlating. There is a P wave, QRS complex, and T wave. Alright. P wave corresponds to atrial depolarization. P wave corresponds to atrial depolarization. Happening because of what electrical activity? SAN fires. When SA node fires, atrial depolarization happens or atrial contraction. Atrial depolarization will lead to atrial systole. Correct? So P wave is corresponding to atrial depolarization. P wave is corresponding to atrial systole. P wave is corresponding to SA node firing. QRS complex corresponds to AVN firing, AV node firing. AV node firing will lead to ventricular depolarization. Ventricular depolarization is what causes ventricular systole. Understand? So now if we have to mark the cardiac cycle here, this will be atrial systole, ventricular diastole. Correct? Atrium is in systole, ventricle is in diastole. Atrial systole, ventricular diastole. QRS will be atrial diastole, or we'll keep the convention of systole first, diastole next. So this will be ventricular systole, atrial diastole. Correct? Ventricular systole, atrial diastole. This will be joint diastole. Joint diastole. When both atrium and ventricles are in diastole. But then why are we seeing wave? If both are in diastole, why are we seeing electrical activity? Somebody explain. Here, atrial systole happened. Before ventricular systole happens, there is during ventricular systole, before the avian fires, and when this is firing, atrial diastole is happening here only. Atrial is already in diastole now. After ventricular systole, atrium continues to be in diastole. Ventricle also goes into diastole. But during this joint diastole phase, that is before another P wave comes, you find a small T wave. That is a reflection of an electrical activity. Why is there electrical activity when both atrium and ventricle are in diastole? For atrial systole, what is happening in the atrium? There is atrial depolarization. In corresponding to P wave, there is atrial depolarization. Atrial systole happens. After this, during this, there is ventricular depolarization plus atrial repolarization. Why am I not writing a ventricular repolarization here? Ventricular repolarization happens after ventricular diastole, ventricular systole. Depolarization happened. Now here, ventricular depolarization is happening. Corresponding to the T wave, what is happening? Ventricular, not depolarization. Ventricular repolarization happens. Into that. Corresponding to P wave, what is happening in the electrical system of the heart? What? Electrical system of the heart. SA node is firing. There is firing of the SA node. QRS complex, what is happening in the electrical system? AV node firing. Alright. What is happening to cardiac cycle when we see P wave? Don't look at the board. P wave corresponds to what of the cardiac cycle? P wave corresponds to atrial systole and ventricular diastole of the cardiac cycle. What does QRS complex correspond to in the cardiac cycle? Ventricular systole and atrial diastole. What does T wave correspond to in the cardiac cycle? Joint diastole. Joint diastole. Tell me the status of the cardiac muscles. Tell me the status of the cardiac muscles when there is P wave. There is atrial depolarization corresponding to P wave. What is the status of the cardiac muscles with respect to QRS complex? There is ventricular depolarization and atrial repolarization. What is happening to the cardiac muscles during T wave? Ventricular repolarization is happening. Okay. When electricity comes, depolarization happens, contraction happens. Depolarization is leading to contraction. Contraction happens, then the muscle electricity is withdrawn. The muscle has to recover. Recovery happens when repolarization happens. And because of repolarization, it gets ready for receiving the next impulse. If there is no repolarization, it will not be able to receive the next impulse. So after depolarization, repolarization should happen. Alright? Heart will teach us a lot. If depolarization, if contraction is considered to be activity, for repeated contractions to happen, for repetitively depolarization to happen, with every depolarization, there is a need for repolarization. How much ever strong the impulse is, if the repolarization mechanism becomes weak, the work of the muscle will become weak. Understand? So heart teaches us the importance of rest. Heart is the master in teaching us the importance of rest. Cardiac cycle is 0.8 seconds. Cardiac cycle is 0.8 seconds. If you look at it, systole is 0.3 seconds and diastole is 0.5 seconds. Heart rests more than it works. But heart works continuously because it knows how to rest between the work. If you understand it, if you can think about it in another way, heart is the biggest kamchor. It appears like it is working continuously, but it is resting more than it is working. So, if you want to learn how to manage your image, along with your efficiency, how to project your work, there are so many motivational quotes that come. Heart never takes a break, it works continuously from the time you are born till you are dead. Be like heart, work continuously. It has managed its image well because it is not taking long breaks. It is learning to take breaks between work. Alright. Heart is not making any attempt to clarify. It is allowing people to be in their own assumptions. Heart could have clarified, no? No, you see, my systole is 0.3 seconds, diastole is 0.5 seconds, so I am resting more than what I am working. Heart doesn't do that. So, the lesson is, if you want to work for longer durations, if you want to sustain your work for a very, very long time, you need to master the art of resting. You need to master the art of resting because efficiency of work will get compromised if you don't keep your working apparatus in good condition, and that can happen only with good rest. Okay. You have 11.5 hours of learning time in the room. If you are feeling drowsy or if you are feeling sleepy in 1 or 2 sessions, either during the lecture class or during the study hour or whatever it is, your work efficiency is going down. You are not able to do what you are intending to do. That is not because you are lazy or not because you don't want to study, nothing of that sort. It is simply because you have not yet learned how to rest. That's why I insist to sleep half an hour at every break. Somebody was asking me, I try to sleep, sir, but I can't fall asleep. I go and lie on the bed, but I can't fall asleep. That is the problem, no? But if I fall asleep, then I am worried that I will not wake up. So, see, tension and relaxation of the muscles of the body is something you can practice. Stretch your body like a cat stretches. Cat stretches you have seen? How it does? Completely stretch. It makes you feel good. Do some nice cat stretches of the body and lie down. Deep breathing with observation of the breath. You'll fall asleep. So many techniques are there. Count sheep. Count from 100 to 1, 1 to 100. So whatever makes you fall asleep. But generally what works for me is just stretch the body nicely, gentle squeeze the body gently, and just lie down. Even if you just rest your back with your eyes closed and just relaxing and squeezing and stretching your muscles for 10 minutes, even if you don't fall asleep, that will still give you a good relaxation. Sitting at one place in bad posture for 10-12 hours makes you more tired. Look at the posture. Somebody is sitting like this, sitting like this. All sorts sorts of postures. Huh? Okay, we'll see. P wave represents contraction of both the atria. True or false? P wave represents contraction of both the atria. We will just say true or false for each of the statements, and if you find some statement is wrong, because the question is about what P wave represents. So one of the options should be true, three options should be false. Whatever is false, you need to correct it. Contraction of both the atria. Is it true? P wave? Yes. Initiation of the ventricular contraction. Wrong. If that has to be right, what should be the modification in the question? Initiation of the ventricular contraction corresponds to what? QRS complex. Or you can say Q wave. Beginning of the systole. Incomplete option. Both P wave, it's correct. Beginning of systole is correct. P wave. But what systole? Atrial systole. It is not a generic thing. End of systole. No. Again, P, QRS complex, both represents that. Okay, explanations we have done. Initiation of the ventricular contraction, beginning of the systole, end of systole. What is ECG? Some small simple questions. Common man questions. Now if you tell your parents or people you know that you are studying ECG, people will ask you. They will assume that you are doctors and they want you to read ECGs also. Now see, read this ECG. So, what is an ECG? Test that measures the electrical activity of the heart. Simple. It is important because it helps doctors see how well your heart is working and can detect any problems like irregular heartbeats or damage to the heart muscles. Different types of problems can be detected. How does an ECG machine know what's happening in my heart? I told you, electrodes are placed on chest. How many leads are placed on the chest? 6. 1, 2, 3, 4, 5, 6. 6 leads in a curvature. Arms and legs. Arms and legs is wrist and ankle. Machine records the signals and displays them as waves on a graph. What do the waves on ECG mean? We have already seen that. P wave, QRS complex, T wave. T wave shows that the ventricles are resetting and relaxing after they contract. Why do we use ECGs and what can we find out? To check how well heart is working. If heart is beating normally, if there are any problems with the heart's rhythm, or if there is any damage to the heart muscles like from a heart attack. Okay? Inverted ST inversion. Okay, I'll teach you one thing which can help you identify if there is a heart attack. MI, myocardial infarction. Alright. Then you can go and see any normal ECG and say you have had a heart attack. Because that can be seen in normal ECG also, you have to correlate. This is S. Correct? This is T. ST inversion can be seen in myocardial infarction. ST inversion, ST segment will be inverted. That will be a key characteristic in the myocardial infarction. Is getting an ECG painful? Is it painful? No. The only pain would be that vacuum suction of your skin. The electrodes will have to receive electricity. So there is an electricity conducting gel put on the body, and the electrode will be placed by vacuum suction. It's completely push out the air and put it. So it will just pull the skin. That's all. This like small pull of the skin is experienced. It's not painful. What is the difference between a heartbeat and the waves of an ECG? Can somebody tell? What is the difference between a heartbeat and the waves on an ECG? Heartbeat is formed because of what? Closure of valves. the atrioventricular valves closing will give you the first heartbeat. Love. Closure of the semilunar valves, that is the valves of the aorta and the pulmonary artery, when it closes, that gives you the second heartbeat done. So, when will the atrioventricular valve close? When the ventricle starts contracting. At the beginning of ventricular systole, the first heart sound is produced. When will the semilunar valves close? When the blood starts trying to come back into the ventricles. When is that happening? After the blood has been pumped and the ventricle is relaxing, the blood will try to flow back. That will make the valve close with the dump sound. So second heartbeat is produced when? At the end of the ventricular systole or at the beginning of the ventricular diastole. Alright. Okay. Can an ECG detect a heart attack? Yes. Why are there different letters P, Q, R, S, T used in an ECG? Convention. Mean nothing. It is just to represent the wave. We need to have something to use as a common reference for discussion. No? So P, Q, R, S, T, all of these are used as a convention. No significance as such. The letters P, Q, R, S and T are just names given to the different parts of the ECG wave to make it easier for doctors to talk about it. What happens if my ECG is not normal? If your ECG is not normal, it means there might be something unusual about your heart's rhythm or electrical activity. This doesn't always mean something is wrong, but your doctor may want to do more tests to find out what's wrong. What's happening? ECG is an indicator of something might be wrong. What exactly is wrong can be detected in an ECG many times, but if an abnormal ECG is found, often there will be more tests done to specifically find out what are the problems. ECG will tell you disturbances in the electrical rhythm. There will be disturbance in the electrical rhythm because of various conditions of the heart. So we will know something is wrong. What exactly is wrong and to what extent, evaluate further. Can everyone's ECG look different? There will be minor variations, but the waveforms are all more or less similar to everybody. This one is what I told. SA node, electrical activity, SA node impulse generation, atrial depolarization, atrial systole, P wave. All of this we have discussed already. See the sequence if you see. SA node initiates impulse. After that, SA node via the intercodal pathway, impulse reaches the AV node. Next, impulse delays slightly at AV node. AV node produces the impulse through the bundle of His, bundle branches and Purkinje fibers, reaches the ventricles. Impulse spreads rapidly through ventricles. Ventricles begin repolarization. This is the sequence of electrical activity that is going on. Correspondingly, we saw that what happens to the cardiac cycle, what happens to the polarity of the cardiac muscles, and what do we see in the ECG. SAN also resets, like the repolarization happens in this, SAN also resets, AVN also resets, but you will not find any significant electrical activity because of that. Did you understand ECG better now? Okay, done.